I've seen the minority health center here in Cleveland under your direction just grow from the time that it first began. I was with you when it began. I'm with you now. I think you've made a tremendous contribution to this community through that effort.
10th Annual Minority Men's Health Fair at Cleveland Clinic. The first year we started the health fair, we had 35 men show up. But as you can see, there's thousands of men here taking advantage of these free preventative health screenings. It's all about early detection of preventable diseases. It is important that we do this. It's important that we can continue to do this. It's about improving the health literacy, the knowledge, the education about healthcare disparities so men can understand how they can better improve their own health care.
Big breath in, big as you can, big, 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 and blast. Now keep going, keep going, keep going.
Minority Men's Health Fair, it's actually open to everybody. It's not just for minority males, but we target African American males and men of color because of the healthcare disparities that are disproportionately really afflicting this patient population. There are some people out there who question the importance of reaching out and doing these free preventative health screenings, but really these statistics don't lie. If you look at the lifespans of African American males, for example, compared to Caucasian American males, 7 to 8 years shorter life expectancy in black men. These healthcare disparities are a real phenomenon, and we don't have to accept the fact that they exist. There's something that we can do about it.
The Minority Men's Health Fair at the Cleveland Clinic has raised awareness within the minority community about taking care of ourselves and addressing health issues that are addressable at a time when there's still things that can be done. We all know now, with the science evolving, that the sooner you're able to deal with certain conditions, the better your chances are going to be, the less invasive the care is going to be, and it's simply about educating ourselves, taking responsibility for ourselves, and encouraging the people we love to do the same thing.
I would say to my colleagues, you've got to come in and you've got to get tested early because early detection is the greatest way to hope for a cure and to beat these diseases.
Our impact, I think, is significant. Over the years of doing the health fairs, and again, we do the Minority Men's Health Center clinics every week throughout the year also. But through us doing the health fairs, we've detected a number of cases of previously unrecognized prostate cancer, for example.
It always happens to the other guy. I got screened at the Minority Men's Health Fair. The results indicated that I did have prostate cancer.
I've had issues with blood pressure, and I didn't really realize that blood pressure could affect so many other parts of your body.
Black men develop and die from prostate cancer twice as often as white men. Black men have a 35% incidence of high blood pressure, hypertension, higher than the national average of 20 or 25%, 80% higher incidence of diabetes. So yes, we are having a positive impact on improving the health of the community.
You know, you can't put a price tag on good health, and tonight plenty of men got free medical care.
I'm joined live now, the man whose brainchild all of this is, Dr. Charles Modlin. 9 years running. What goes into planning this?
Hundreds of people attended the 9th Annual Minority Men's Health Fair at the Cleveland Clinic.
Joining us today is Dr. Charles Modlin, the founder and director of Minority Men's Health Center at the Cleveland Clinic. Thanks for being here, Dr. Modlin.
Thanks for having me.
We appreciate you being here.
I'm so appreciative of the leadership of Cleveland Clinic that have allowed us to do this. They're very supportive. Dr. Cosgrove, Dr. Klein, Dr. Sabani, and others. We're trying to break down the barriers that have historically prevented men from coming in.
They don't trust the system. I trust the system. It's no big deal to me, you know, when you're getting a health check, you know, but I think some of the men just afraid to, you know, they don't trust doctors. I tell them it's very important that you trust the doctors. You know, the service that's rendered is very good. It's for your health, your benefit, so you need to go out and get it done.
We're doing screenings for high blood pressure, diabetes, heart disease, high cholesterol, HIV, hepatitis C. The men are very appreciative of the fact that we do this. and they're responding. So this is really a remarkable turnout, remarkable event. All these men coming in here, they came in here on their own volition. In many cases, some women behind the scenes help push them here, direct them here. But the bottom line is they're here. We see ourselves as a pilot project, a pilot program, whereby other institutions can come and see what we're doing and then establish their own initiatives.
I think this men's health care initiative is one of the best models that I've seen, and I think what Dr. Modlin is doing here at the Cleveland Clinic, we can use this as a model to actually use throughout the United States of America, and I really applaud him for his outstanding efforts.
I would look to a day when healthcare disparities are eliminated, and I think we're on the right path. I think a lot of it centers around education, educating people about the importance of preventative health screenings. Because again, as I mentioned before, we don't have to accept the fact that black men die 8 years earlier than the majority population. And a lot of those death rates are preventable. A lot of those death rates are due to healthcare disparities. And I think we can see an end to that.
Thanks to Cleveland Clinic for saving my life and being there for me, and God bless them.